Medical practitioners too. Hospital staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of four main groups. A pre-registration house officer (PRHO) or house officer is a newly graduate doctor in the first years of graduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training of the Foundation program, the name for these junior doctors is Foundation Years 1 Doctor FY1. A senior house officer (SHO) is in the second year of postgraduate training. The title is now Foundation Years 2 Doctor FY2, but the older senior house officer and SHO are still used. A specialist registered SPR is a doctor who has completed the foundation programming and his training is on of the medical specialty. There are also some non-training registers, doctors who have completed their training but do not wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. Medical teams. Consultants, physicians, and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors but also of physiotherapists and other allied health professionals. When when patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the wards where they will receive training and care. The junior doctors clears them, take their medical history, and examines them. Sometime later, the registrar also sees the patients and may order investigation or death. For example, X-rays or ECG make a provisional diagnosis and begin treatment. Treatment. The council usually sends the new admission people who have recently been admitted to the wards for the first time on one of the regular wards rooms when the management of the patient is discussed with the registrar. Consultant also decide when the patient is ready to be discharged. On the war rooms, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's car. Chief. Doctors now normally work in shift, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. the next day. After a week, they change to a different shift. For example, 3 p.m. to 11 p.m. or 12 p.m. to 7 8 a.m. Their alternative system is to work from 9 a.m. to 5 p.m. every day and to take tours to be on call, available to return to the hospital if necessary. From 5 p.m. to 9 a.m. The next days on call are set out in a rotation or lips of name and time. Doctors on call carry a radio pager or beeper at their side which make a noise when someone is trying to contact them.